Let's go to those figures, what it might mean, because the PM said on Sunday that the means test would, if it's blocked, would punch a $100 billion hole in the cumulative budget by the year 2050. Now, as plenty of people have pointed out, and I'm sure you're aware, there's no mention of that $100 billion projection in the intergenerational report. Where did that figure come from?
Well, the projections are quite clear. We have Treasury briefings, which I understand have been released, that were all based around the intergenerational report. You would understand, as would your listeners, that we get briefed from the departments as well as the report itself. That's been released. It makes clear that those figures are right. But we've been saying for more than 8 months, since the budget last year, that it will be nearly $2 billion of expenditure in the next 4 years, $10 billion in the next 10 years, and this is just a further projection. What it shows is the cost of providing assistance to very high income earners grows significantly over time, and that money is precious, scarce health dollars that we actually think could be used in a more strategic way. And ultimately that's what a lot of health reform is going to be about. How do we use our money strategically, make sure that additional investments do drive needed reform, and make sure that our system remains fair for all of the community? And we think if this is a step that the Liberal Party can't take, then the future for health reform is obviously only going to be something that we and the public can deliver, because the Liberal Party clearly are not interested in it. And in fact, that's what their record of 12 years in government has shown when it comes to health.
And how would you feel about going to an early election, a double dissolution election on this issue, the issue of taking a rebate away from some Australians?
Well, we're not looking for a double dissolution trigger on this. We're looking to get the measure passed. We think it's sensible and fair. We think it makes the health expenditure more sustainable into the future, and we think it frees up money to spend it on more strategic and legitimate, if you like, support, perhaps across the system. Maybe it's for cancer patients, maybe it's for new drugs, maybe it's for new technology, something that everybody will benefit from. And ultimately, I actually have great faith that the public are with us on this. Should a taxi driver have to pay for and support, me getting private health insurance or a millionaire getting private health insurance? It's actually quite a simple argument to make, and I think that the Liberal Party will obviously need to take account of that.
And just very briefly, Minister, you were forced to back down on the Medicare rebate cut for cataract surgery. Now, you went very hard on this. In fact, the government ran TV ads criticising the specialists, the ophthalmologists, as greedy. In the end, you've had to back down, and the ophthalmologists, according to your figures anyway, are still going to be getting, for what you say in some cases is a 15-minute procedure, around $730 per procedure, which means they can earn more than $24,000 a day.
Well, look, this was a compromise that was reached. We do believe that the cut could have been more significant, and the ophthalmologists very vehemently believe it couldn't.
Why did you back down?
Well, we've met each other halfway, and we've been able to secure, with their agreement, a $47 million saving. This is not an insignificant thing to do.
It's not halfway, is it? Haven't we only got a 12% cut now, not 50%?
Well, there's a range of things that affected. There are the cut, there is the freeze in the indexation period, which has a very significant impact as well. And what we've also agreed to do is have a review of the actual item numbers so that we can resolve this difference of opinion into the future. Now, we feel that very strongly, and the ophthalmologists feel that our view is wrong very strongly, and it's sensible to be able to reach a compromise so that for the coming 2 years, the patients will have security, the ophthalmologists will have security, we will get a significant saving, and we've got a process to resolve it long term. So ultimately, that's what happens in politics. Sometimes you've got to make compromises, and I think this is a pretty sensible one.
Perhaps especially in an election year. Nicola Roxon, thank you very much for joining us.
Thank you.